Medical professionals have read it. When did you have to tell a patient, "I've seen it all before," to comfort them, but really you had never seen something so bad or of that nature? Story 1 by Cloud9. Not medical professionals, but we were the patients. My daughter, who was 3 at the time, had to have a cavity filled. As we were leaving, the dentist told me just to watch my daughter because sometimes kids chew their gums because it's numb and feels weird. So the drive home took 30 minutes, and I had been talking to my daughter the entire time to keep her busy. I park my car in my driveway, open the passenger seat to get my daughter out, and her entire lower lip on the left side is gone. She had chewed it off down to her chin. She ended up in emergency surgery, but the surgeon kept telling us it would be fine, and he sees this stuff all the time. She ended up having multiple surgeries, and when she was finally healed, the surgeon told us that it was the worst injury like that he had ever seen. He wasn't sure how she would heal, but you can hardly tell it happened now. Story 2 by Mama Bear 4485. Years ago, my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubts about her recovery. A year later, we went back for a review, and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked-out reaction, I commented on how cool and calm he was and how certain that she'd be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts, since he had no idea how he would put this child back together. He also told me had used the films as a teaching aid. He's one of my heroes. Story 3 by Aikiled Tupac. A dog bit my little sister in the face, ripping through her mouth and cheek. It was at a soccer game. She crawled on top of a big dog called a borzoi, which startled it. It rolled over and bit her. This was the late 80s, smaller town. There were no pediatric surgeons available, no plastic surgeons. She was in the ER with her face ripped open. Anyways, our general pediatrician, who is now my kid's pediatrician 30 years later, who had only graduated maybe 10 years prior, sewed her face back together. It was 30 stitches on the inside of her mouth and 30 or so on the outside. She had a massive scar down the whole side of her face. Anyway, fast forward 15 years. She grew normally, her face is fine, her smile is fine, no long-term damage. Apparently, a face is full of nerves and muscles, and that's why only plastic surgeons work on faces, particularly with children. Having nerve and muscle damage can make their face grow crooked as they age. It is a highly specialized field. But in this case, there was nobody else, just a general pediatrician, and he managed to save her face with no long-term nerve or muscle damage or even scarring now that she's an adult. We found out 25 years later from our pediatrician's wife that he spent an hour or so crunching his old med school books in the seat of his Plymouth Reliant in the hospital parking lot, studying facial anatomy, nerves and cheek structure, etc. He walked into the hospital and performed a multiple-hour surgery on her face, sewed it back together perfectly. You would think a plastic surgeon did it. His wife told us he came home that night, just flopped down on the couch and sat there, amazed that he'd done it. Proud but cautious. A new general pediatrician sews a toddler's face back together. And it worked. Now, you would never know it happened. And he has never, ever done another surgery like that again. Story 4 by Pokemon Gangbang. Damn, these usernames are, interesting. Had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious and alert to what was going on. His jaw looked like Predator. I had family freaking out, of course. had to tell them we see worse often. Which may be true, but they are usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. Story 5 by Gillyflowers. I work in gynecology, and I had to chaperone a male doctor for a pelvic exam. Patient was complaining of pain and discharge. Her vaginal area was completely red and swollen. He then, so gently, inserted the speculum to get a look. An immediate white cottage cheese-like substance comes pouring out onto his lap and hits the floor. Imagine dropping a container of cottage cheese on the floor. We stare in disbelief. He then had to remove the speculum and use it like a spoon to scoop out more discharge just so he could get a look inside. He tells her it's a yeast infection and she'll be good in no time with the prescription medicine. That day, I learned if you smile while humming, it helps in suppressing your gag reflex. Takes cottage cheese off grocery list forever. Story 6 by an unknown user. I was the patient, actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery was the surgeon telling me everything was going to be fine, and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube through my neck, and I was very uncertain about reality due to what I went through in my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I lived. I was told over and over that my survival was very much against all odds. My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped when I had to go back to his table a few more times before I was done. For 4 years, I kind of blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love and eventually trusted her enough to let her read my medical records. I had never read them because it's a massive pile of paperwork. She broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore, and I don't want to know anymore. I now know my doctor has one hell of a poker face. Story 7 by Anytime is Tea Time. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest-ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me. He just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check. Can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat, and I'd make sure someone was with him right away. The last story is by a salted fish. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left-turned without checking. He had gone over the hood, slid, and somehow somersaulted, landing on his arse, sitting up. He slid across the intersection mostly on his arse, getting serious road rash. Luckily, he was only a block from the hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and arse, when all of a sudden his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his arse. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal, and dry heaved. Bonus story by Embering R. Genital warts the size of grapes on the guy's pecker. Quote, "The ladies never complain? Nope, I'm out. Screw this nightmare thread. Not after the cottage cheese story and now grape warts. If you enjoyed these stories, don't forget to like, subscribe, and share it with a friend. One with a strong stomach. See you in the next one.